What's going on YouTube? It is Adrian Hawkins of HawkFit bringing you another video. This is a continuation of the series that we have called Rehabbing an Injured Athlete. So without further ado, let's grab the doctor and figure out what part we're gonna rehab today.
A rib subluxation. This is where a rib kind of comes out a little bit. I don't know if you've ever felt that before. That's an injury. It's a semi kind of injury, but a lot of times when people cannot breathe, they have to go to the urgent care or ER to at least relieve on the pain. When your rib comes out, it is so painful. Matter of fact, when you inhale, the rib sometimes will poke into the side of the lung and the back side of the lung. Of course, there's three pieces of lungs. There's 1, 2, 3, and then on one side, and then the other side is 2 pieces of lung. And of course, the rib kind of cages it together. And a lot of times, if someone is about to do an incline press, because of the unilateral movement of the dumbbell, so you're going like this, like that. That movement of going one at a time, or uneven lifting that as you lay down on the bench, can sometimes pull the rib out of place. And then it just kind of floats up there. And then it starts to poke every time you inhale and exhale. So that's the injury we're going to talk about today, is injury to the rib. We're not talking about a fractured rib. A fractured rib, really, there's not much you can do about it. You're just out of luck with that one. Of course, now there might be other sources of treatment for that, but as far as I know, orthopedic-wise, there's no cast you can wear for a fractured rib, especially a rib that has completely fractured and then they've separated. That will have to maybe surgical procedure, I don't know. But a lot of times a fracture that's not completely broken, that one you just kind of have to wait it out until that's over. The kind of injury I'm talking about is where the rib kind of comes around in a convex, concave, and then inserts in that little foramen or into the side of the spine, the thoracic region. And then when you try to lift, and because of thecal pressure, it kind of plucks it out, and then it kind of floats like that. That's the injury we're going to talk about. There's some muscles involved with that. Of course, there's the intercostals, the muscles between the super part of the rib and the bottom part of the rib itself. And then, of course, there's the longissimus muscles that run from the bottom of your spine, which is the base of your sacrum, and those kind of attach and attach to each rib as you ascend up towards your skull. So let's talk about how we can rehab an injury because of a subluxated rib, and you can Google that too, just a subluxated rib. All right. As you can see, a lot of times when someone is doing a side row or doing a deadlift, how these muscles here, the serratus, when you're bodybuilding, see, this is serratus anterior, this is the serratus posterior, this is the Christmas tree, they call it. That's the Christmas tree right there. See, when you, and I've seen you do this, where you do something like that.
So he's talking about the posing for the Christmas trees right now when we hit the back spread.
So that's the muscle that you're showing off there. See that there? There. That's the Christmas tree. That's it. And then of course when you do something like this also, when you do this, which one is that one?
The obliques?
Yeah. And then you show off, do you know these? Those are called the serratus anteriors. Mm-hmm. Those are the ones that when they spasm, they'll pull the ribs out. There they are. See those? Come to this other picture over here. See how they attach to the rib? So when you're about to do a bench press, you'll see how that will pull that rib out. And so someone can have pain on the front side of the sternum or on the back side of those. And then when they're trying to breathe, they feel that pain there, the discomfort there. See how that pulls on the back side there. One more, and then let's see. Okay, see how the chest comes and attaches to the sternum? And you see those serratus again going into the rib directly. These directly attached to the ribs. The intercostals, they call them. And then the obliques come in and attach to the ribs also. So there we are. So let's go look at some exercise that will help with that. Christmas tree. You know, it's a kind of like a spruce shape right there. And you see how that is depressed. The muscles have come around and they're tucking that in. Tucking that, and now bring that back. Now I want you to do the beginning of it. There. Now you can see that there. So all these muscles, these are the serratus posterior that come and feed onto that and then create that effect. So any workout that we're going to be doing is anything to tap the rib, the cage. Now turn around. That's the serratus posterior. And now here comes the anterior. You see these here? And then dip like you did. There you go. That's these are the serratus anterior that attach directly to the rib. Right there. Alright, that's good. There it is. That's it. There's the serratus anterior. There it is. Superior serratus anterior. So that, as someone who works out, an injury can happen because that directly attaches to the, and you edit that to show the, you know, between the diagram we looked at. So when that tightens up, it pulls the rib cage in. Do you feel that effect?
Oh yeah.
You feel that effect? And that can do what? Can subluxate, turn around. That can, there you go. Look at that. Now that's the back side of it. These are the posterior serratus. They feed into that and attach to the rib. And that's the rib I'm going through. So when these muscles get stronger, they pull and make the rib cage thinner. And if there's too much of it, that's good. And if there's too much of it, then we have a subluxation of the rib. So any exercise that we're going to do now will be related to what? Making that tighter, making that muscle so that it doesn't yank it out, but it's just strong enough so that there's elasticity in there. And guess who we're going to use? The therapy bands. The therapy bands, that's what we're going to use. So, and then I want you to roll and tuck it in. Yeah, I want a big valley back there. There you go. Big valley back there. He's rowing, but he's using a therapy, and I want you to feel your back doing what? There you go. Come, yeah, create a depression back there. There you go. There you go. Now let's do a side view. Side view. Yeah, and there you go. There you go. That helps it tuck in. There you go. That helps it tuck in. That helps it tuck in. That helps it tuck in. Good. Good. What happens now when he is doing that, shoulders in your back pocket, when he's doing that, when a chiropractor or a doctor of chiropractor come around, and rib number 1, rib number 4, 5, 6, 7, up to 12, if one of those are the ones that are subluxated, then I take my hand, and when I adjust, I put P to A, posterior, anterior to posterior, AP, A to P. I put pressure on that, the vector is down, and as my thenar and my fingers get on the rib that has been subluxated, and with his weight coming on there, that's when we put the rib back in. Does it make sense?
Makes sense.
Okay, so what had happened is because of the spasm of the muscle had pulled it out of its cavity, or where it sits, I pulled it out, and so by me putting my clean and hand on it, I push it back into the hole. All right, let's go and do an overhead. I'll go get the bench and we'll do an overhead. We're trying to create a bigger depression along the back. The bigger the depression it is, the more the ribs are tucked in to the spine. Because what happens when you are trying to do a bench press, as you sit backwards and you are unevenly spread, one of the muscle works harder than the other and either yanks one of the ribs off the right or one of the ribs on the left. All right, so let's do this next one. The next one is an overhead extension. And I do a perpendicular one for people who are really, really serious about it. So why don't you lay down, right? And then and I'll put this on you, yeah?
So we're doing an overhead extension?
Overhead extension.
Are we doing butt down?
Butt down, yes sir. 1 second, let me tune this up.
So if you want, it might be easier for you to just hold it.
Okay. All right, so then now I don't have to tune it.
There you go.
You sure this is 35 pounds?
Yeah, it feels heavy, doesn't it? That's a true. So I'm gonna bring it down, and there you go. So I don't want you to do that tricep extension. I want you to do a straight arm overhead extension, straight arm. What am I doing wrong? I'm trying to fine tune it. Oh, no, I think I fixed it. There you go. Okay. All right, overhead.
Straight arm?
Straight arm. So you can see. Oh my goodness, that is amazing. As he does it, I'm gonna come closer. All right, all right. And then come down. Look at this muscle here. Look at that muscle, how directly goes into the shoulder blade. Subscapularis, the lats, keep going. There you go, keep going. There you go. So as he does that, what he's trying to do, as he goes that way, the rib cage is all lifted up, it's really moved up as one piece and really tucked in. There you go. And that's enough. Good. It's really tucked in, that's enough. It's really tucked in. Do you feel what I'm saying?
Oh yeah, absolutely.
Yeah. So try and explain that to me.
Absolutely.
The idea of doing that, tucks that. The idea of doing this, tucks it in, and the muscle memory is created to create a rib cage that's tight. And when I adjust, it helps. It helps because the muscles are trying to push it all in, and then my digits line up with the rib cage, and as he lays on it, pushes it back and tucks in the subluxated rib into the spine. So for example, with him, right now I see there's something here. It might not be necessarily that rib that's out, but there's a muscle up there that's kind of hyperactive right now. And it's kind of, there's a little bit of a muscle bulge. But that, do you feel that, is it tight?
On the right side?
Yeah. Does it feel tight? Yeah, so that's kind of what I want to address. There. See, his muscles are developed, but this side is higher, so that tells me that his rib has kind of turned a little bit that way, and is creating that little fold there. Yeah, right there. So what I'm going to do is I put and I don't want you to do it, but I put my fingers and I match up the rib that I want to adjust, and I'm going to let him lay on my hand, and as he lays on my hand, that's going to create the rib to move back in. Okay? There. Okay. Cross your arm.
Like this.
Yeah, So that takes the shoulder blade out of, and you breathe in and out of the traction even. Ooh. And he'll tell you how that felt. It's a whole bunch of goodness. All right.
Enough.
And that's it.
All right.
Okay, rib subluxation. Thank you.
There we go. There we have it. There's just a few different things you can do to help if you've had some rib pain, some rib cage pain, some serratus or some oblique issues. Basically, it just, a lot of what I went through today will just help loosen up shoulders, rib, maybe even rear delts a little bit. And so with these, obviously you can use these as lifts. I mean, obviously when you're lifting heavy, you can do these and these will work out your muscles. But if you're looking for like a warm up or to just kind of loosen things up a little bit because you're feeling tight or tense, go ahead and do it. And it should help you achieve either recovery that you're looking for or help you push forward in your pursuit of greater gains. Until next time, thank you.